Thank you, Mr. Basil. And I would like to thank Dr. for giving me this opportunity this evening. And I'm really honored to be in the platform of all expertise from this perioperative nursing field. And I would like to just address and echo what Renee as well as Dr. Sena had raised up. And it's wonderful to see on one part of the world, there's a structured program and where there's progress in this field. But on the other side, as Dr. Zena said, the difficulties that we face in terms of preparing and the challenges that we face in terms of preparing perioperative nurses in UAE. Now, I'd like to just highlight some things that probably, I'll be able to say is, as an example of a nursing system in healthcare organization, it's probably the same in terms of the eastern part of the world, or even most of the part of the world like here, as well as in situations where there is not development in terms of education in this field. Now, for the benefit of the audience, when we talk about perioperative, the first thing that comes to our mind is we're thinking of only operative room. It is not so. It starts from the preoperative, intraoperative, and outside when they come out. It could not be just only in the operative room, as I have listed for the benefit of you, because we don't have this sort of a specialization in a country like ours. It could be in different areas. Of course, major it happens in the operative, but it could be in an intervention radiology or a diagnostic radiology suite. It could be in a cath lab. It could be in a surgeon's office. Nowadays, a lot of ambulatory surgeries are done, emergency trauma unit care, and you can list on the place where a perioperative nurse is useful. Just first of all, we need to get the thought that it is just not technical work, because this is what was taught about by many people, or even people in nursing who taught earlier, at least from this part of the world, thought it's just technical. You don't need science behind it. But there are a lot of core nursing skills, as it was echoed by others. Critical thinking. If a surgeon, for example, a cardiothoracic surgeon is coming in tomorrow to do a particular surgery on a child or an adult, he rehearses what happens in the theater. That's exactly what the nurse who's going to also assist needs to know. She needs to know how he's going to perform, what are the things that she needs to get on and keep ready. And if this happens, what she needs to do. If that happens, what she needs to be ready with. So it kind of goes through the whole thing. So she needs to have that critical thinking. Absolute aseptic technique. We know the importance of it, and no other area is as more important than that. In terms of legal guidelines, she has to be sure that this person who's operated has gone through all the process, which is right in terms of the right of the patient, right for the country, and policies and procedures. She's going to work with diverse people and patients. The kind of people who are going to come in theater, the emotions that they go through, all that she's going to leave. In the midst of it, safety has to be kept, and it has to be evidence-based, absolute quality care. When a surgeon gets a claim that he's the best surgeon and he does the surgery in a certain, in a short span of time, the credit goes to him, but the credit actually comes from the nurse who's assisting. That's important. She also has to think that, pre-op, post-op, maybe intraoperatively, she's not talking to the patient, but before and after, if she's a perioperative nurse, she needs to know what kind of education she needs to give to the families who are stressfully waiting outside in anxiousness, and colleagues who are assisting, because if the team has to work well, she has to be a person who's able to educate. And fundamentally, she needs to have knowledge, skills, and judgment. So what I'm trying to bring is, to the people who are listening, if you are not taken this area of work, it is not technical. It's absolutely scientific based. The knowledge that I put in some pictures, you can see a typical day in a OR. It can never be a day where you can think, oh, today is light. My list is light, so it's going to be light. And that day, one patient can go into serious issues. And there can be so much of issues that she needs to face in terms of being a perioperative nurse. So absolutely, she needs to know surgical intervention. In perioperative nursing, different specialized areas are important. If you are assisting for a knee replacement, it's so different from a person who's assisting for a cardiac surgery. So she needs to know all about the intervention that happens, all about instruments and equipments, what is to anticipate, how to plan this, and the aseptic technique process. She's a person who need to assess, everybody has assessed and brought the patient, but she needs to be sure that the person is ready to go into theater for surgery. Interpersonal skills, this is the most stressful place. It's a different kind of stress. And critically thinking and deciding and being able to risk manage at any point. And she has to be someone who is based her care in terms of evidence-based. Teamwork is absolutely mandatory. She cannot let anyone work in silo. And participating in multidisciplinary. For example, suddenly in between the surgery, they need a blood result. She has to ensure that she's getting the path or biochemistry labs or wherever it is getting the result, ensuring it's fine. And she has to be someone who has to have that educational attitude, wanting to be learning every day, not once and for all, and always ensuring that there is a positive patient outcome. Now, this is what we are talking about capacity. Why I just gave this preamble is the challenges that we face because of all that is required of her. What is capacity building? It's a process of developing and strengthening the nursing skills and her instincts and the abilities, processes, and resources that the organization and the nursing profession need to survive, adapt, and thrive in a fast-growing, changing world of healthcare. I just put this picture. You imagine she's a student nurse. Okay, if she's all gowned up and gloved up, and she just believes that she's a perioperative nurse. You give her a tray of all the used instruments. What does she know? And if you ask her to go pack it up, how does she know what needs to be done? And there's a lot of critical thinking process, planning. There's so many things that goes on for the knowledge of the science of that surgery. So this is capacity building. Now, I just want to come to our country with a few slides. If you have read on the Centennial 2071 project, which was launched by the Cabinet of United Arab Emirates, they had actually brought in for 2071 UAE healthcare in the next 50 years. They had 3 goals, strategic goals to achieve the future of healthcare in this country. One of the most important one is growing and attracting talent. And only the best healthcare system can be provided with best talent. That is their point of promise or point of vision that has come up. And for that, you need complex needs requiring clinical specialists. When we talk about clinical specialists, it's just not the surgeon. It's about every healthcare personnel. And a perioperative nursing field, it is an important, the nurse who is there handling this procedure. So there is a vision for this country already about specialization in the next 50 years that is set. Based on that, in 2022, we had the UAE National Strategy for Nursing and Midwifery, a roadmap for 2026. I would like to just bring in a few slides, importance of it. According to this roadmap, there are 9 domains, and there are 5 different priorities that are shown. And one of the priority is quality and innovative education and professional development. I just like to read it again. Quality and innovative education and professional development. The country has realized that in every area of nursing, you need to have innovative education and professional development. Whichever method that we are going to achieve it, we need to have that. And I would like to highlight one more of that is advanced research, evidence-based practice, response to national priorities. Both have to be scientifically going on if you need to advance innovative education. And just to come to the sub priority in terms of quality and innovative education and profession development, there are 2 things that has been highlighted by this strategy that is planned for 2026 is establish postgraduate nursing or midwifery specialization and advanced practice programs. The country is looking forward to some kind of higher education, which would go to the career trajectory of every nurse. Today, if you look at almost 99% are general nurses who have been trained in their own country, specialized, and learned only at work about their work. But for a person to become a specialist, you need to ensure that there is a scientific structured learning and develop national nursing midwifery professional development framework. These are the two important thrusts that is placed in terms of quality innovative education and professional development by the national nursing strategy. Now, all of us have already echoed this. If so, if you want to build capacity, there are three different areas. One is your system, which is the governance. And already the country has decided that if you need to have, you have to build capacity, there need to be a plan. And so there is already a plan. The second and the third level is where we are talking about today, the organization. As the previous speaker had said, the private and the public, they've got two different objectives and two different ways of functioning. They need to understand there need to be a change in the consciousness and awareness of behavior and skills in relation to how they move forward so that you can get effective addressing the global change and achieving sustainability. When that happens, the individual also will get focused in terms of their knowledge, their attitude, their skill and motivation and different area of specialization, very specifically today in terms of perioperative nursing. Now, what are the challenges that we are facing today? Of course, if you take governance, lack of human resource development policy, the country is already putting in. Maybe earlier there were not enough training facilities, so we are looking at various methods like how AORN can be brought. As echoed, the country is also looking at residency, multiple residency program that can come in so that there is training facility. There is lack of induction training, which doesn't happen in any specialization area. You just get a nurse, get her registered, and she starts learning at work. There's no induction. Now, if you look at organization, there's not visible leadership is not there. There's an unsystematic everyday routine, pull anyone and put everyone. So there is no structure and poor working condition. And absolutely professional development opportunities are lacking in many places, especially in nursing. And there's no respect for these profession. If you are a perioperative nurse, you need to be so proud that you are one so that you're able to do that. There is no incentive for them to be a perioperative nurse. So these are things that at organization level, it's a challenge. And proper records of the perioperative registered nurses in the country. And so they will be the one to take up responsibility and bring that particular specialty forward. And of course, lack of opportunities. And so hence the individual is not motivated. This is the major challenge that we are facing. And finally, what happens is this nurse takes it just as a job for her living and doesn't take it as her passion, as her expectation that she is. And so there is, between the competence and responsibility, there's a diverge, and there's no congruence. And so there's no capacity is limited. Now, all of us have said multiple ways. These three levels capacity has to be built. I just found this picture. You need to have operating room immersion program, at least to initiate with. And that is something that even without even a residency program can be started so that every operating nurse, when she comes in, there need to be an induction training that goes on there, so that that nurse becomes confident and competent and excited about becoming a perioperative nurse. Now, let me say about a few words because I am working in the educational arena, and let me just say about education, what's happening. In terms of perioperative nursing, the students get taught this subset of adult health nursing, or we call it medical surgical nursing, different terminology of the course. In that, one of the subset is perioperative nursing. Of course, when you take a Bachelor of Nursing preparation, it's a very generalist preparation. And in a BSN curriculum, they get maybe about 2 units to learn about it in terms of perioperative, intraoperative, and postoperative. And after that, they may get maximum about 4 weeks placement in the theater or in a place where operations are conducted. What does she learn there? She just learns, maybe how to go surgical gowning, gloving, setting up a tray, how to assess and also observe. And they have a couple of procedures to be observed or surgeries to observe. Beyond that, at a bachelor level, that student is not going to gain anything much because it's a generalist program. So and this is for every branches of nursing, it's like that. So when does the nurse then become a specialist? When she chooses her niche area, there she needs to have a postgraduate specialization. It's not available. It's a similar story in every area. So today there's a proposal by National Nursing Midwifery Council to commence many accredited clinical postgraduate program. And one of those can be perioperative nursing or a master's program, as someone said, or a certification program, a residency program, maybe by the international organization like AORN, to bridge the gap between the standards of perioperative care and in UAE. It can be even initiated by the Compass Health Group, as we have met today. So this is how it should be. I just saw this final slide. I saw this textbook which says professional master's degree for operating nurse and intraoperative care. I hope and pray that our country will reach this position very soon. So this is my thought and take on what I've been asked to, and I hope I have shared some views that it be insightful for others. Thank you.